gaps and are really excited that we've had to date 317 applications for those so-called bricks and mortar grants. But we also recognize that that federal funding is going to end. The pandemic is coming to a close, we hope soon. And at the end of that, the state of Maine has stepped up. Maine has invested among the first in the nations in its child care workforce, providing $12 million to add salary supports, a salary supplement program that began in October and will be refined next July. We also, beyond childcare, are launching some exciting new programs. The Maine's Early Childhood Consultation Partnership, or ECCP program, has been piloted, and we expect it to go statewide early in 2023. We also have been piloting the Ages and Stages questionnaire, an online initiative to promote access to developmental screening and linkages to services. We're excited that the pilot is going well, and we're hoping to be fully operational soon. We also have on the horizon the First for Me program. This is a 2-generation whole family approach that we're piloting in a set of sites across the state in hopefully next year or early next year. And we expect that that will be a way for us to learn how to organize the set and range of services for children on site. But today, I am very excited to announce the launch of the Help Me Grow program, which as of this morning is live. Help Me Grow supports the early identification of children birth to 8 years old with developmental and behavioral health needs and connects them to early intervention services. Help Me Grow is a system, not a standalone program. It builds on what already exists in Maine. This means that it knits together agencies and programs that serve these children to work together to support the whole family. This is done through a centralized access point, a call line and website, developmental screenings, and training for professionals. This is a free statewide service thanks to the legislation that enacted it. So if you or someone you know would like to access this service, you can call 211 or call toll-free 833-714-7969. That's 833-714-7969. And we also have a way to provide online confidential referrals. You'll hear more about this new program in this hour, but I will just pause to say how very proud we are here in Maine to launch this service. We are the 29th state in the nation to be coming online, but as Alyssa reminded me, one of the fastest from start to finish because this team is so committed to getting this great new service up and supporting the professionals who care for children in Maine and their families. And with that, I'll turn it back to Alyssa. Thank you.
Thank you so much, Commissioner. It's so important, and we're so lucky to have your support this morning. With that, I'll also get the pleasure of introducing Dr. Todd Landry. Dr. Landry began service as the Director of the Office of Child and Family Services in April 2019. The Office of Child and Family Services is comprised of 3 large programmatic areas, including child welfare, children's behavioral health, and of course, early care and education. The staff of the Office of Child and Family Services totals over 900 individuals. Dr. Landry has led the implementation of countless system reform initiatives in each program area that have led to improved well-being of children and families in Maine. Prior to being the Director of the Office of Child and Family Services, Dr. Landry was the Chief Executive Officer of Lena Pope in Fort Worth, Texas. Lena Pope is a nonprofit that serves children and families with an array of prevention and early intervention services, including childcare, public education, mental health counseling, and juvenile justice. He previously served 3 years as Director of Nebraska's Division of Child and Family Services, and also sits on national boards, including the Child Welfare League of America, which is a national coalition of private and public agencies working to improve the lives of vulnerable children and families. Dr. Landry holds a bachelor's degree in chemistry and a master's degree in business administration. He earned his doctorate degree in educational leadership from the Simmons School of Education and Human Development at Southern Methodist University in Dallas, Texas in 2018. He and his wife, Carrie, have one daughter, Madison, who serves as a Foreign Service Officer for the U.S. Department of State. Please join me in welcoming Dr. Landry.
Alyssa, thank you so much for that kind introduction. It's been my pleasure to work with Commissioner Lambrou, who I'm delighted to have with us on the call today, as well as Alyssa and her entire team. It's been one of the great privileges of my career to be able to lead the Office of Child and Family Services, and a real pleasure to be with all of you this morning as we celebrate the launch of Help Me Grow. Something that Commissioner Lambrou reminded us of not long ago was just an idea of implementing here in Maine just a few years ago. Many of you I know are familiar with our colleague in the Department of Health and Human Services, Dr. Amy Belisle. Dr. Belisle has been an advocate for Help Me Grow for a number of years, along with many of you on this call. And it's a great privilege and pleasure to be able to celebrate the launch of Help Me Grow today, because we know how important that service is going to be to help children and families in our great state. One of the things that we have as a foundational belief at the Office of Child and Family Services is that high quality early care and education is one of the strongest protective factors for all children and families. We're very pleased and proud of the work that we have done to support early care and education, including the ways that Commissioner Lambrou indicated just a few minutes ago, and some additional ones that I'll share with you in the next few minutes that I have time with you this morning. One of the things that I'm really pleased about is, despite the incredible challenges of the pandemic, is the way that the early care and education, specifically the child care sector, and our team at OCFS stepped up during the past 2.5 years to ensure that support was being provided to our child care sector field and to our Maine children and families. One of the things that we did was to ensure that funding that was available to the state was dispersed efficiently, effectively, and quickly. And I'm pleased to say we were among the first in the nation to push out large amounts of dollars in supporting the field during this time period. We also were very transparent about that. We've monitored and provided data dashboards of how those dollars were spent, how those dollars were utilized, in order to ensure that we're being effectively transparent with our communities, with our neighbors, and with all of our colleagues in the state of Maine. One of the things that I'm also very pleased about is our work with state and regional coordination efforts. We've been a great partner and have appreciated the partnership with the Department of Education. And recently we applied for the preschool development grant. And that couldn't happen without great coordination between our office, the department, and the Department of Education. I'm also pleased to support and happy to say that we've been moving forward with our early intervention work group, which was a cross-office collaborative group that is convened through the Children's Cabinet in order to ensure that all of our work aligns together to support our common goal of helping Maine children and families. I do want to point out real quickly the 2022 Child Care Plan. We initially implemented this and publicized this, I believe, in 2020 or in 2021, excuse me, and we've provided updates since then. If you haven't seen that, I encourage you to go to our website and check it out. It provides a great comprehensive plan that not only provides you with clear information about how the state is investing those federal dollars that Commissioner Lambrou indicated, but also how it aligns with our overall Children's Cabinet goals associated with access, quality, and workforce. In the access area of our child care plan for Maine, we have 14 objectives. And one of those critical objectives is to launch Help Me Grow. We set that out as a goal for us. With the support of the legislative initiative, we're able to implement that today, and we're very proud of that. We've also put forward a number of initiatives to help increase access to child care services through workforce. Workforce is another area that has been critical to supporting the child care sector during the pandemic and beyond. We have 6 specific objectives in that child care plan for Maine, and those included the implementation of the child care stabilization grants. that we have 1 year to spend based on federal rules. Happy to say that all $73+ million has gone out to support child care providers and workforce in the state of Maine. Specifically, over 1,500 providers have received those child care stabilization grants during that time period. As the commissioner indicated, we've also been implementing the infrastructure grants, $15 million allocated in the governor's Maine Jobs and Recovery Plan. To date, we've had over 300 applications from both family-based providers as well as center-based providers to expand or build new facilities. And most recently, we implemented the child care transition grants. We heard from all of you about the concern about the end of the stabilization grants. So we wanted to make sure there was a transition period as these federal dollars begin to end in order to help our providers in the state. I believe we're one of the few in the country that have implemented these transition grants. Those started in October, and the second payment is going out today, with over 1,100 providers or programs in the state receiving that. And last, I do want to point out the salary supplement program that the commissioner indicated. Very pleased to say that with the support of the legislature and the leadership of the governor, we were able to embed into our budget the opportunity to continue those stipends that started during the stabilization grants, and those will be ongoing. And beginning next July, there'll be a tiered structure of those supports to staff across the state based on experience and education. Last, I would be remiss if I didn't talk about quality. We know that quality makes a difference in the lives of children and families and how successful our programs can be. We have 13 specific objectives in the plan focused on quality. Those include expanding and strengthening business practices for child care programs by adding an additional technology incentive so that they can help use technology to push their quality forward, and the Early Childhood Health Consultation Network, one of our more recent initiatives that we've announced to help improve quality and support for programs in our state. These are just some of the ways that we have tried to utilize the federal and state dollars to support child care programs and the early care and education segment in the state of Maine. I do want to say a quick thank you to the team that you're going to hear from today for all the work that they've done. As I indicated before, it was only a few years ago that we talked about Help Me Grow, First for Me, and some of these other programs as ideas that we could potentially implement in the state. Because of the dedication of the team members and their colleagues that you're going to hear from on today's call, we've been able to do that quickly, efficiently, and effectively. And that's good for all of us. It's good for all of us in this sector and in this field. More importantly, it's good for Maine children and families and for Maine's economy. Our commitment is to continue to support children and families in Maine by implementing these programs and others that increase access, improve quality, and support the workforce that is essential for childcare and for our Maine working families. My appreciation to all of you who are on this call and all of your colleagues around the state that are dedicated to providing quality early care and education for Maine's working families and for all of our children in the state. Maine's strong economy is in part reliant on a healthy child care sector and early care and education. Equally important, Maine's children and families benefit from the availability of these high quality programs. My thanks to all of you. My thanks to the team that you're going to hear from. And now let's get started with some of those very exciting announcements as I kick it back over to Alyssa. Thank you all very much.
Thank you so much, Dr. Landry. And again, thank you, Commissioner. Without further ado, let's hear about Help Me Grow. The Help Me Grow team is led by Angie Belfler. Today, you will hear from her staff, Melinda Corey, who is the Help Me Grow outreach specialist. If you haven't met with Melinda yet, I'm sure that you will. She has been out and about talking about the program. Additionally, we have the pleasure of having our close collaborative partner, 211, here with us. And Nikki Williams will be representing 211 today. So I will turn it over to Melinda and Nikki.
Thank you, Alyssa, and thank you to the whole team here. We certainly could not have done the implementation of this program in the amazing way that we have without the support of everyone behind us. So really grateful to be here and excited for this day. Next slide. So we're going to give just the briefest of overviews about Help Me Grow today. Many of you have heard a little bit or a lot about Help Me Grow already. And as Alyssa said, if you haven't, you sure will. So today will just be a quick overview along with our partner programs so that everyone has some of the most important basic information that you need to know about this. So Help Me Grow is a central access point to help connect families here in Maine with information and services that they need. In partnership with our collaborative team over at 211, caregivers and providers can contact Help Me Grow to get support for a wide range of developmental and other resource needs. When folks reach out to Help Me Grow, we will listen to them, link them up with information about development and community resources, provide them with referrals if needed, and also, very importantly, provide follow-up to caregivers and referral sources like healthcare providers and childcare and early education providers, so that everyone is on the same page on a child's team about what resources the family is able to access. How it works. So our central access point is available to the community in several different ways. So as Commissioner Lambrou mentioned, you can reach us by phone. You can also reach us very easily through our new online referral portal that we'll talk about more in just a moment. We are a low barrier resource, and so there are lots of different ways to access us. We help support the network of already existing services here in Maine. So we know that for some families, when they need a resource or a service, it's easy for them to get plugged in and have that service or resource flow reliably and consistently to their child and their family, and their needs are met. But we know that for many other families, it's not that easy. It's not always simple to navigate the systems, to have the time, energy, and other things that are needed to get plugged in. And sometimes things don't flow as consistently to everybody across the board. So Help Me Grow is here to make that connection stronger and to ensure that families get connected well and successfully to the grid of resources that are out there for them. We also are strong supporters of developmental screening. As was mentioned, we are utilizing the Ages and Stages developmental questionnaires, which I'm sure many attendees are familiar with. These questionnaires for young children are very parent-friendly and help parents and providers to identify earlier the things that young children may need support with to be successful in their future development. We have access to the Ages and Stages online through our website. So it's quick and easy for parents to click in, enter that information, and then receive a call from one of our awesome resource specialists to share the results and to get them connected with whatever they may need. Regarding our eligibility, we are available at no cost to Maine children birth to 8 and their caregivers. We also are supporting pregnant people here in Maine, so we have a broad range of supports that we can help people with across that early childhood spectrum. As we worked with our partners at 211 Maine on today's presentation, several frequently asked questions came up that we wanted to make sure to address. And as has been mentioned, if there are other questions, please make sure to get those into the Q&A function so we can be sure folks have all the information that they need. So when people reach out to Help Me Grow, they can share as little or as much information as they feel comfortable with. The more information that is shared, the better we're able to meet the need with the most local and up-to-date resources. But we understand that some families are more comfortable sharing information than others, and we will meet the need in whatever way we can with the information that we're provided. Our resource specialist team can initiate calls to families based on referrals from other providers. So as a very low barrier resource for the state of Maine, there are lots of ways for families to connect with us. It may be that families call us directly after being told about Help Me Grow, but we can also accept referrals from other providers, our healthcare partners, early care and education providers, partners in other agencies and programs. All are welcome to refer families to Help Me Grow. And then we will initiate that important work of reaching out to families to get them connected. There are several pathways, we call them pathways of inquiry. That's just ways that we can help people. And so we can directly help families in need, like we've been talking about, getting them connected, referring, providing information. But we can also support all of the providers out there who are seeking resources on behalf of families that they're working with. So if you're a provider out there today listening in, and you're thinking, gosh, I have a 4-year-old that I'm working with that I could really use a conversation and some ideas about how to help them and what's available to them, that's a great time to reach out to Help Me Grow as well. And with the family's permission, Help Me Grow resource specialists follow up at 5, 25, and 60 days following initial contact, and of course, more often if needed for the family to be successful. This short-term care coordination allows us to ensure the success of the family's connection with whatever we have been working with them about. So regarding our implementation, as was mentioned, we're so excited. Our central access point is fully live. So our phone lines, our fax lines, our online referral portal, everything is live and accepting referrals at this time. Our online referral portal has I call it the big blue button on our homepage where anybody can click, provider or caregiver, to send a child our way for support. Our Ages and Stages questionnaire online portal has already begun receiving screenings. We've received 45 screenings from our early care and education providers, as well as several from the general public. And those numbers are only going up from there. And we've reached well over 1,000 child health, early care and education, and community partners since earlier this summer through outreach presentations, webinars, and conference participation. So we're really happy to be getting the word out. I invite Nikki now to join in and share more about our collaboration with 211.
Hi, thank you so much for having me this morning. So I manage the 211 Maine program for the United Ways of Maine. And for those unfamiliar with the 211 Maine program, we are a free confidential helpline, helping individuals across the state find local resources that help them stay healthy, safe, and independent. So think heating assistance, transportation, food pantries, and resources for families. So 211 as a Maine-based program with a contact center here in Maine that's available 24 hours a day, 7 days a week, 365 days a year, and a statewide directory of all these types of resources. We really are a great partner with the Office of Child and Family Services of the state to really be a great access point for Help Me Grow and for people to be able to get connected to these amazing specialists. So to connect to Help Me Grow, we really wanted to utilize the 211 as that 3-digit, really easy to remember code. And so you can call 211 and press 5, and that will automatically connect you to a Help Me Grow specialist. You won't have to go through any of the 211 processes. You'll just directly go 211, press 5, and connect to Help Me Grow. Now, if you call 211 and you connect with a specialist, say you don't press 5, you can either specifically ask for Help Me Grow, and our 211 specialists are trained to provide a warm handoff to a Help Me Grow specialist. Or, you can talk with a 211 specialist, and if you identify kind of a Help Me Grow related need, so anything around developmental services or any kind of need for a child under 8, our team are trained to, again, identify Help Me Grow as a potential referral for you and offer that warm handoff. So if we do offer Help Me Grow as a resource, or you call 211 and press 5, and it's outside of the Help Me Grow hours, which are Monday through Friday, 8 to 5, there will be an option to leave a message for the Help Me Grow team, or you can always, again, speak with a 211 specialist. We can offer the Help Me Grow referral, but can also help you look for alternative resources. So we're really trying to make it as easy as possible for both families and providers to find the most appropriate resources. So, you know, again, we're really happy to partner with the state. And where this is a launch of a brand new program, we know that things will grow and change. And so we do really encourage your feedback as the process moves forward.
Thank you so much, Nikki. Again, before I finish up, I just want to thank everybody for all of the support, for your attendance today, for your openness to learning more about these supports, and for being the people who are out there, boots on the ground, doing the hard work of getting families what they need each and every day. We are so grateful for all of you. If you want to learn more about Help Me Grow Maine, our website, as well as all of our other contact information, is here. Our website is a wealth of information, as well as those great online options for easy referral and online screenings. So please feel free to check that out and to reach out. In particular, if you'd like me to come and talk more with your team about how we can work together to support your work, I'd love to do that too. Thank you.
Thank you so much, Melinda and Nikki. With that, I am going to turn us over to Crystal Arbor. She is the Child Care Services Program Manager. And all of that financial information that Dr. Landry and Commissioner Lambrou shared at the beginning was really administered by Crystal and her team in order to get out to the childcare providers. So with great pleasure, I turn it over to Crystal.
Thank you. Good morning. I will be speaking briefly about several components of our unit, but it's not all encompassing. So certainly if there are other questions, and I know that there is a chat going, I will work to answer those after, as we know, and certainly always reach out with other questions. So the Child Care Services unit really is the three programs up on this slide are work in high coordination through the majority of funding through the Child Care Development Block Grant. And so the Child Care Subsidy Program, as many know, helps families to pay for childcare so that parents can go to work, to school, or participate in a job training, or both. CCSP is also available for eligible families where the adults are retired or legal guardians. This is something we are very happy that we were able to add in 2019 with our rule updates. The Child Licensing Investigation Services works closely with our office here at OCFS. And this is the unit that oversees licensing and children's residential. They also oversee the Child Placement Agency and child care providers. That also includes our CCSP licensed exempt providers. And then, of course, with the background check unit, part of the Child Development Block Grant requirement is that all child care providers and staff that provide direct care are required to have a full childcare background check that includes fingerprinting. And so that is also held here at OCFS and coordinated within our office. Next slide. For the Child Care Subsidy Program, we try to meet all families as best we can at their need. And we are currently also in development of a new data system that will be even more accessible. But as currently, there are 3 ways to apply. We have it on our subsidy page where it can be printed and filled out and completed. It can be mailed in, faxed, or emailed. We can also contact our office, and we can mail a copy to individuals. And then, of course, at our local DHS offices, there are printed copies and can place them at any time. And the email box here is the CCSP at dh@maine.gov. We have just last month updated our income guidelines. And so those two are posted on our website, but want to point out that we are at the 85% of the state median income, and really looking at that increase for a family of 4 that can make just over $84,000 and still be eligible annually for our program. So certainly if there are any questions on whether a family qualifies or not based on their income, reach out to our office. Next slide. And then within our unit, I'm very proud to say that we are local. Our unit is all local here in Augusta. And so they are financial resource specialists that review the caseloads. They are centrally located and divided by county. We try to keep them as aligned as possible so that the families and the providers are typically the same financial resource assigned. And with that, there is greater coordination and certainly trying to keep that, you know, is very helpful for those families to be able to have the same individual to speak to on the case. And then if the provider has questions as well, and that contact information is here. The subsidy program has 2 different web pages. One is the information for families and all of the resources, financial guidelines, the sliding scale fee, and links to other resources, as well as translated materials, including our subsidy application, are all on that family website. And then similar for our child care providers, our subsidy page for them have, again, our child care subsidy application provider agreements by provider type, and also in translated materials and other additional very helpful resources on that webpage. So I encourage providers to check that out, including many of our incentives that we have that are in addition to our market rates to really balance out and increase reimbursement for those children that they care for. And now, as earlier mentioned, is our early childhood workforce salary supplement program. We've just implemented this last month. This is transitioning after our ARPA stabilization grants. As indicated, over $73 million went right into the provider's hands, fully liquidated that in 12, well, we ended up with 13 payments to providers. And with that, there was almost 82 individual staff bonuses that went out over that 12-month period, totaling over $16.3 million. And so with the support of the state and leadership, there is federal state funding to continue that salary supplement. That is in law, that is ongoing. Currently, it is $200 staff bonuses, but in 2023, the requirement will be in the rulemaking process to make that a tiered system based on individual staff's Maine Roads to Quality registry level. So there'll be more to come in the new year on that, so stay tuned. But as of right now, those are $200. Last month, we made our first payment. And the second payment is about to go out within the next few days. And included in that, we really created these transitional grants that are incorporated into those monthly payments. And so the program, for program eligibility, they have to either hold a facility or family childcare license. That's part of the rule, is they are for licensed programs only. They must be open and providing direct care at the time of the month. They must have a valid vendor code with our office, and they must be active in the Quality for Me rating improvement system. For the workforce to be eligible, they must be employed by an eligible program. They must be registered and active in the Maine Roads to Quality registry. They must be providing direct care to children. This also includes owners and directors. So if you're a family child care provider, you are eligible for these staff bonuses, these supplemental salary as the owner and director and providing care. All eligible staff, oh, I did say that, sorry, excuse me. And so part of this is we have the Child Care Transition Grants. This is utilizing our ARPA discretionary funds now that we have liquidated our stabilization funds. This is an 8-month program we've created to really step down after the end of the stabilization grants. So for the first 4 months, it's based on a child care provider's capacity, license capacity for $50 per slot. And then the final 4 months will be at $25 per slot. We've allocated $13.6 million to further support and stabilize our workforce and programming. And thank you.
Thank you so much, Crystal. So much work getting all that money out and really using it to the benefit of the early care and education workforce and children and families. With that, I'm going to turn it over to Amy Beaulieu. She's the program manager for Maine's Early Childhood Consultation Partnership Program, and I'll let her tell you a little bit about that.
Thank you, Alyssa, and thanks everybody for joining today. I know we've heard a lot about a lot of different initiatives and we have a couple more to go. So I'm gonna fly through the information. Some of you may have heard me do similar presentations in the past because we've been live since January of 2021 and been doing a ton of outreach. If you want further information, you can always contact me directly and my contact information will be at the end, or look at our website on the OCFS webpage and there'll be a link at the end of my slides as well. So what is ECCP? ECCP is an evidence-based model of early childhood mental health consultation that we've brought to Maine. It's a model that's been used in Connecticut for about 20 years and used very successfully. At this time, it's the only evidence-based model or research-supported model of early childhood mental health consultation. And so Maine elected to implement that model after legislation directed the department to implement early childhood mental health consultation in Maine. And as Commissioner Lambrou indicated, we have been piloting ECCP since January of 2021, and we anticipate going we are planning to go statewide January of 2023, so very, very soon. So ECCP is consultation. That's part of the title of the service. It's not treatment, but it is consultation. All of our early childhood mental health consultants that we have are licensed clinicians, but this is not treatment. They are not going in and providing treatment directly to children. They are providing consultation, and it really works to build the capacity of the adults who work with young children 0 to 8 and how to manage social, emotional needs and behavioral challenges of children that they're working with. We're available to childcare settings. So whether you're a licensed childcare facility or a licensed family childcare provider, we're available to public pre-K programs. We're available to do consultation on individual children in public school settings through the age of 8. And we are also available to after-school programs to consult on individual children who may be having behavioral challenges or social emotional needs in those settings as well. And again, this is a service that's available to programs and to children who are between the ages of 0 to 8. And the overall goal, I just want to stress, is to reduce the disruption of children from their early care and education setting. I think the pandemic only highlighted how crucial it is for children to have that safe, stable care setting for both their own social emotional development, and also it's important for parents and economic stability. And so if we can prevent disruption for social, emotional, or behavioral challenges, that's what we're here for. So what do the mental health consultants do? They work directly with the programs to implement strategies to directly address whatever the concern is. So a childcare provider will bring a specific concern to the consultant, and that can be on a classroom basis, a program basis, or with an individual child, and say, I've used all my tips and strategies and I am tapped out. Do you have anything additional that I could try? And so we have a very systematic way of doing consultation where we go in and we do observations, and we really work with the provider, using their strengths, using their existing resources to be able to recommend and then model and coach the provider in strategies that can address the challenges that are going on. So we don't just come in and give you, you know, a list of things to try or some books to read. That consultant is there with you over an extended period of time, really modeling and coaching and supporting the provider in how to meet these challenges. So some reasons to request consultation. Oh, if we can flip back to the other slide, sorry. You know, obviously behavioral challenges, talking to families about behavioral or social emotional needs. I know that can be a challenge for providers. We've been working a lot on teacher stress and isolation and teacher retention since the pandemic started. And we can also work on things, you know, things that are really normal developmental concerns, but are a challenge for the provider to address for whatever reason. There's no judgment in consultation. So we get called in a lot for things like biting. And we can offer some tips for that and help the provider work out a strategy that works for them to address that. Next slide, please. So we have three main types of services within the ECCP model. We offer child-specific consultation. So that's really about an individual child who may be presenting with some social, emotional, or behavioral needs. That encompasses up to 9 hours of consultation. It includes classroom and home observations. The family is very involved in this service. They must consent and agree to be involved. This is a totally voluntary service. And so if the family is not on board, we won't step in. But we bring the family and the provider together to get on the same page about what's going on with the child and make sure that whatever we recommend works at both home and the early care and education setting. And this is a service that's available in licensed centers, family child cares, public pre-Ks, public schools, and after-school programs. Our core classroom service really focuses on the overall functioning on a social, emotional, and behavioral level of a classroom as a whole. This is for a center, for a licensed facility or a center. We can also do this in public pre-K classrooms. And that's a very extended, intensive service. The consultant works with the providers for 12 to 14 weeks. And that can be about things like, I'm having trouble with transitions in the classroom. My classroom is very chaotic this year for whatever reason. Or things like, I really want to learn how to talk to children and teach them about how to verbalize their feelings, and I don't feel very confident in that. How can I do that well? And so the consultant can work with them on that. We are now offering up to 8 hours of PD credit for participating in core classroom services, and that can go towards elective credit on people's registry or their main roads to quality PDN registry. The department, we just announced a $5,000 stipend that we will also be offering for providers who are participating and are able to complete with us a core classroom service or a family child care provider service. More details will be coming on that. We are developing the guidelines for that right now. We will get that out as soon as possible. And then our last type of service is a family child care provider service. It's very much like a core classroom service, except it's really honed and tailored for the unique needs of a family child care provider. And that's up to 2 hours of consultation a week over 9 weeks. And we also give PD credit for that service. Next slide, please. So where are we? Since we've been in a pilot phase, these are the counties we are currently in. Each of these counties has 1 or 2 full-time consultants. The gray areas are the areas we will be expanding to in early 2023, and each of those areas will also have a full-time consultant. One thing that I can add that is brand new is that we are now able to serve Piscataquis County. Our consultant who is currently in Penobscot County is now able to cover that area as well, and that is a new development as of this week. So if you are a provider in Piscataquis County, you can feel free to contact the Penobscot consultant if you are interested in services. Next slide, please. Some additional things that we offer to support providers in the community. Each consultant offers quarterly community trainings over Zoom on a social emotional topic, and we do award PD credit for that. Consultants are now offering monthly mental health consultation groups. Those are open groups where people can bring challenges that they have or topics they'd like to discuss around early childhood mental health, and the consultant facilitates the discussion around that. And those are over Zoom as well. I mentioned the 8 hours of PD credit we're giving, and also our consultants get involved in local community collaboratives around early childhood issues. So if you would like to have a consultant join a work group or a team that you have, please let us know, and we'd be happy to connect you with that consultant. Next slide, please. Very easy to make a referral. You can, on our website is a list of each consultant for the area. You contact them directly. They ask you some specific questions about what's going on and triage the need, and connect you with services. You can also request ECCP through the PDN, either through the warm line or contacting your DC. And we also are able to connect providers that we work with back to the PDN if there are quality issues, larger quality issues that they want to work on. We can also do a warm handoff to the PDN as well on our end. Next slide, please. Here's a listing of all of our consultants. The exact same thing is on our webpage. So if you want to go to that and scroll down all the way to the bottom, you can find the contact information, or you can always contact me and I will connect you directly. Next slide. And here's the contact information and our website. Thank you all so much. If you have any questions, please feel free to be in touch anytime. And now back to Alyssa.
Thank you, Amy. Next, we are going to hear from Jessica Garish. She is the Child Care Infrastructure Grant Manager.
Hi there, everyone. Thank you so much for having me today. I'm going to try and fly through this as much as possible as we are a little bit behind schedule. But if you have any questions, please feel free to email me and then check out the website, which is on the next slide. Thank you. So as you heard, $15 million in federal funding has been allocated for the Child Care Infrastructure Grant Program through the Governor Mills Main Jobs and Recovery Plan. Funds are intended to support providers to open, renovate, expand, and/or construct family child care or child care facilities. So the goal of this grant is to increase child care within the state. Thus, eligibility is contingent on either increasing license capacity or opening a new child care, thus creating new slots. Funds are expected to add more than 3,500 new child care slots within the state. And on that link down below on that website, you can find the application. There are about 5 variations of the application, and that's dependent on the specific situation that the individual is in. Thus, there's an application for family child care startup. So if you want to start up in family child care, there's an application for family child care growth, increasing your license capacity as a family child care. There's an application for facility startup, facility expansion, and facility acquisition. And each of those are based on that situation. So each application has 2 parts. So application 1 is basic information. It's gathering documentation like zoning letter, water test, director qualifications, if applicable, etc. The internal review team reviews the first application and determines if that meets all the requirements. And then the individual gets sent a link for application 2. Application 2 consists of the business plan, which includes your budget, your hours of operation, all the nitty-gritty details of your business. Again, once application 2 is submitted, review team reviews that, and if everything is met and everything is satisfactory, an award is made. And payments are based on milestones tailored to the individual's business plan. OCFS is administering the Child Care Infrastructure Grant Program through a partnership with CEI. And as of this week, there are about 126 FCC providers and 191 facility providers with applications either in process or submitted. So lots of work happening around the grant, very exciting. So, thank you.
Thank you, Jessica. And last but not least, we have Meg Swanson. She is the First for Me Early Care and Education Program Manager.
Thank you, Alyssa. I'm tasked with being the closer of this amazing webinar, and I am very excited to be the preview section of our time together. Next slide. So first for me, just a quick overview was included in LD 1712, which was enacted in 2021. It looks to improve social, emotional, educational, and health outcomes for children under 6, not yet enrolled in kindergarten, through high quality early care and education. This is a 2-generation community-based approach to have a coordinated birth to kindergarten entry. And it really does work to do that comprehensive services. So a lot of the programming that you heard of today will be interfaced and working with that at both the local and the state level. There are 3 priority focuses for First for Me: the early education and care setting, family supports, engagement and stabilization, and kindergarten success and transition, either at the pre-K or the K level, depending on where your community has for resources, through a high quality mixed delivery system. Next slide. We have been in consult with KVCAP, Educare of Central Maine, as the Elevate Maine Somerset was the demonstration model for First for Me. We've also had additional partners with Head Start and the First 10 Initiative. There will be up to 5 pilot sites chosen to commence starting in January, with an annual funding of 2.9 over the 5 sites. We look to support collaborative relationships with communities, families, childcare providers, and the local school administrative system to bridge from that mixed delivery to the school setting to set up for success as best we can for all children. And nonprofit organizations will be the facilitating and accountability partners. They will be the main people that will have the sites and the applicants. There will also be a coalition of key roles within each community so that there is a lot of a robust and responsive community work and activities within it. Be on the lookout for a request for application very, very soon.
Thank you so much. So proud of this amazing team and what we've been able to do for children and families in Maine. Thank you all for participating this morning, and thank you all for all the speakers for your expertise and time. The slides, in fact, are already posted. So again, overachievers here. And I just wanted to remind folks that the Q&As will be posted alongside the webinar once we have the chance to flesh them out. You can access any of these services as well as the 211 support services by calling 211, calling the toll-free number for Help Me Grow directly, and or making an online confidential referral on our website. With that, we will close the webinar, and thank you all, and we look forward to the continued collaboration and partnership over the next year and beyond.